Good morning, everyone. Welcome back to Saddleback Eye Center. This morning I'll be going over your drops with you and how to take care of your eyes after the LASIK procedure. So all of you this morning received a bag from us. Inside of that bag you have a blue folder that looks like this. If you open up the blue folder to the right hand side, you all have a chart. This chart goes over each drop you'll be doing starting today, day 1 after LASIK, for the next few days. So I will go over the drops. You have 2 different antibiotic drops that you're using. First you have the Vigamox. The other antibiotic drop you're going to be using is the Pred Forte. For the next 5 days, starting today, you're going to be using the Vigamox 4 times a day for 5 days, the Pred Forte 4 times a day for 5 days. So you're going to want to alternate between these drops every 2 hours. So if we do Vigamox at 7 a.m., Pred Forte at 9 a.m., Vigamox at 11 a.m., Pred Forte at 1 p.m., and so on. After the 5th day, you're all done with the Vigamox, no more Vigamox, so the only antibiotic drop you'll be using days 6 through 10 after LASIK is the Pred Forte. Pred Forte you'll be using 4 times a day for days 6 through 10 after the procedure. After the 10th day, you're all done with the Pred Forte. That's all with the antibiotic drops, which leaves us with the last and most important drop you'll be using, which is the lubricating drops. So this morning you all should have received in your bag a box of Sustain Ultra Preservative Free. It's very important that you do buy these type that come in the small vials for the first 3 months after LASIK. So starting today, for the first month after LASIK, you want to use the lubricating drops, these little vials, at least 2 times per hour while awake. Months 2 and 3 after LASIK, you want to please be using these at least 1 time an hour while awake. For the rest of the year, months 4 through 12 after LASIK, you can use the lubricating drops just 4 times a day. But again, remember, the more the better. There's no such thing as using too many of these drops. Something else to note is whichever drop you just put in, wait a good 10 minutes before putting in another drop. That way you do not rinse out the drop that you did previously. As far as the restrictions after the procedure, last night you all wore the goggles. You'll get to wear those for 5 more nights while you sleep. Today, everyone's doing a great job at either having on your goggles, clear lens glasses, or sunglasses. Very important we keep our eyes covered at all times for the next 5 days and nights. No swimming for 1 week. The second week you can swim, just use waterproof goggles. After the second week, you do not have to worry about wearing goggles or anything. Besides that, there's no sweat in our eyes for the next 10 days. You can work out all you want starting today, but please make sure you're using a towel, sweatband, or hat to keep sweat from going in your eyes. No heavy weightlifting for the next 3 days. Heavy, meaning more than you're used to lifting. For most of us, that's what would be 100 pounds or more, just because we don't want you squinting or squeezing your eyes. And the last restriction only the ladies have to follow, which is no eye makeup for 3 days. After 3 days, you can resume eye makeup. However, I'd recommend not using waterproof eye makeup for the first month because we know how hard it is to get off the waterproof makeup. That's all as far as the restrictions. This morning, some of you may notice some redness in the white areas of your eyes. That is purely cosmetic. It has no impact on the vision. That will all go away. It could take a total of 2 to 3 weeks to fully go away, but that will have no impact on your vision. It is not permanent. And now just a few more things I'll go over with you before we go back into the exam rooms. And we have a great referral program here. We really appreciate anyone you refer to our office that has LASIK. So anyone you refer to our office that has LASIK, you will get a $50 Visa gift card. So we have given you these little business-sized cards of referral cards that you can give to your family members or friends. We certainly appreciate your good word of mouth. And then lastly, all of you will receive this morning a review card. Dr. Manger reads these every single day. These are very important for him to hear about your experience, how everything went for you yesterday, anyone that really helped you. The more we can get you to write, the better. Dr. Manger would love if you'd be able to write this full little page about your experience. So that's all as far as the drops, as far as the restrictions, and we will get back with you shortly to take you to exam rooms. Thank you.